Good morning. Hello, everyone, and thank you for joining me today for a discussion on mental health and behavioral health during the COVID-19 pandemic and how the American Rescue Plan that became law yesterday is supporting mental health and substance use programs in our community. This week, we marked roughly a year anniversary since the pandemic began. For a lot of us, this has been a grim reminder of just how much we have all been through this year. As a country and as individuals, the financial and physical toll have been devastating. And yesterday, President Biden signed the American Rescue Plan into law. I'm proud that this legislation is going to save lives and livelihoods of people across the country and in Illinois' 14th congressional district. It provides $275 million to Illinois to speed up the distribution of vaccines and set up community vaccination centers. This effort will make sure that we have enough vaccines for all Illinoisans and that we can deliver the vaccine to them quickly and equitably. It's going to provide relief to families and businesses in need and make approximately $169 million available to Illinois 14 schools so they can stay open safely, and make up for lost learning time to get our children back on track. There's so much in this legislation that will put our community on a road to recovery. And I know that a lot of people have questions. And that's why tomorrow morning, I'm hosting a virtual town hall to discuss the new law. And I hope that you'll join me. I'm going to put the link in the chat below where you can find more information about how you can join our town hall and ask questions. But before that, I wanted to bring this incredible group together of stakeholders and talk about the psychological and emotional toll the pandemic has had on all of us. Over the past year, I've met with organizations and individuals across the 14th district, and no matter who I'm talking to, whether it's a farmer in Marengo or a teacher in St. Charles, they have all expressed concern for the mental well-being of those in their community. I want to make sure that everyone in the 14th district is connected to resources and support. And that's why my office created a behavioral health resource guide with information on how to get in touch with organizations nationally and in the 7 counties in the 14th district that can help. I'm going to share the link to that guide in the chat as well. And you can find it anytime on my website at underwood.house.gov under the coronavirus page tab. That's also why it was so important to me that any relief package addressed this need. And it's why I'm grateful that the American Rescue Plan included $4 billion in an investment in mental health and behavioral health services in our communities. The plan includes funding for substance abuse prevention and treatment and community-based mental health programs that support youth mental health services and suicide prevention efforts, as well as the National Childhood Traumatic Stress Network, which develops and promotes effective community practices for children and adolescents exposed to a wide variety of traumatic events. Programs for mental and behavioral health to prevent burnout among healthcare providers. We've been hearing about this so much. And among our public safety officers, including training and outreach, and so much more. In addition to the American Rescue Plan, I'm an original co-sponsor of the Stopping the Mental Health Pandemic Act, which would provide resources to expand access to mental health screenings and treatments, suicide prevention, and support for local healthcare providers who've been on the front lines of coronavirus response efforts. And last year, I introduced my Primary and Behavioral Healthcare Access Act to ensure that private insurers cover up to 3 mental health visits or substance use disorder visits per year without any copayment, coinsurance, or deductible related fee. As we continue to face the hardships brought on by the pandemic and other crises, access to mental and behavioral healthcare services has never been more crucial. I hope that the discussion that we're going to have today is an opportunity to talk about the emotional toll of the pandemic, to remind everybody that it's okay to not be okay. It is. And it's to connect everybody with the resources and the people in our community who are standing ready and willing to help when someone's in a crisis or just needs to talk. 3 of those people are joining me here today, this morning, for this discussion. They and their colleagues at the organizations they represent have truly been on the front lines of caring for our community's mental health and well-being long before this pandemic. I am so thankful that they could join us today. But before we get into the discussion, I wanted to introduce each of them and give them a few minutes to talk about their work and their experience over the past year. First, I'm happy to welcome Scott Block, who's the Executive Director of the McHenry County Mental Health Board. We have Raul Garza, the President and CEO of Aunt Martha's Health and Wellness, and Bruce Johnson, the CEO of Nakasa Behavioral Health Center. Scott, let's start with you. Can you share a little bit about the work that you do, your overall impression of the COVID-19 pandemic and the impact it's had on the mental health and well-being in our community, and any key challenges or issues that we're still facing after a year of isolation and anxiety and loss?
Certainly. Thank you. And good morning, Congresswoman.
Good morning.
Thank your leadership. Your backing of the American Rescue Plan and healthcare access in general is giving this topic a very wide audience, and we appreciate that.
Yes,
While
sir.
COVID-19 certainly poses a significant risk to physical health, it's just as important to highlight those mental health and well-being issues that we've been collectively experiencing. So I'd be remiss if I didn't take a second and thank and acknowledge all those mental health professionals that you referred to who have been working on the front lines as essential healthcare workers since we learned about the magnitude of this pandemic. And if any of you guys are listening, we do thank you and owe you a debt of gratitude. As the executive director of the Mental Health Board, since the start of the pandemic, I've been actively representing the McHenry County Behavioral Health System as the formal contact on our county pandemic and planning response team. At no other time in my 20 years in the behavioral health field have I seen this much attention on individual mental health and mental health services. So it will be our challenge to make sure that that sentiment remains after we move past this moment in time. I can say with great confidence that prior to COVID-19, there were few issues that impact our communities quite like behavioral health. The extensive prevalence and pervasiveness and reach of mental health was also referenced as the public health challenge of our time prior to the pandemic. And since it's often referenced as the pandemic within the pandemic. Research prior to COVID-19 indicated that 1 in 5 individuals would experience a mental health related issue at any point in time. About 1 in 12 would struggle with substance use. And since the start of the pandemic, those numbers have skyrocketed. Furthermore, trauma is another behavioral health challenge expected to be exacerbated by the pandemic, and researchers are warning that the pandemic could inflict long-lasting trauma on millions of Americans, and that will be another mental health issue that we'll have to face. So these combined stressors, the global nature of the pandemic, the isolation, social distancing, employment impacts, these are all taking their toll. We could point to a number of studies that quantify these numbers, but when I speak with people, I often say when you're talking with your family, friends, or colleagues, just listen. In those conversations, you'll hear themes of fear and of personal safety, safety of loved ones, increased health anxiety, increased depression from social isolation and loss, even anger and frustration. So my message today is one of hope for those feeling stressed and nervous a little bit. There are millions of Americans that are in that same position. And we are here today to talk about the passing of the American Rescue Plan and existing resources. Hope and help is out there. And I look forward to our panel discussion to discuss some of the resources we have available throughout the 14th. So again, thank you for the invitation.
Thank you, Scott, so much. I'd like to now welcome Raul to the conversation. Hi, Raul.
Hey, good morning, Congresswoman. And first, I want to thank you for bringing us together today and really for all the resources that you've fought to bring into the communities of the 14th District, but also for the entire state of Illinois, especially around mental health and substance abuse. So it's my privilege to be part of this conversation, and I just want to share with you, with the audience, just some of the work that we've been doing, and I'll need some visual assistance to do that. So if we can go right to our presentation. So for those that aren't as familiar with Aunt Martha's, this is also a great opportunity to make you more familiar. So we are an organization that obviously is focused on serving people of color. Over 80%, in fact, 88% of the people we serve are people of color. Also, 26% of who we serve are 26% are people who are uninsured. We also reflect in our faces and in our ethnicity, race, culture, the people we serve. So 80% of who we serve, 80% of our staff are people of color, while our leadership is representative as well at a little bit over 60%. So it looks like we got off track with the slides here. So I think just bear with me. Okay. And I think that the focus of our model really centers around integrated care, which is why treating mental health for us starts at the primary care setting. It gives us an opportunity to screen patients for depression, anxiety, but also any other mental health diagnosis. And the map, the state map here, gives you a sense of Aunt Martha's presence, certainly in the 14th Congressional District, but then also throughout the state. And a lot of that's really attributed to our telehealth capability and really telepsychiatry, which has been a focus of ours for the past 14 years. We can go to the next slide. So specifically in the 14th Congressional District, we served in the past year over 8,000 people. 41% of those are considered people of color or minority. 39% are Hispanic or of Latino descent, while 12% are African American. That's translated to providing over 27,000 visits. 16,000, nearly 800 are in person. But I think, again, speaking to the whole telehealth technology, nearly 11,000 were done through either telepsychiatry or telehealth visits. And I think that's important because at Aunt Martha's, we don't believe that healthcare necessarily takes place in the four walls of a clinic. We have to go to where the patients are. And certainly over the last year, that has been a necessity, especially as it relates to mental health. If we can go to the next slide. In terms of, again, the growth in visits, you can see that over the past several years, there's been significant growth in terms of telepsychiatry, both in patients and in visits. And then the same can be true just overall in general, what COVID has done in demanding us be more telehealth focused because patients having concern with coming into the clinic setting, although I strongly believe that coming in our clinics is probably even safer than going into other public domains. But you can kind of see our activity there for the past, really since we adopted telehealth in 2007, but over the past several years. Let's go to the next slide. And then this is a slide I find interesting because it really does show what we've seen over the past year compared to the previous year. So when you look at the five most prevalent diagnoses before COVID-19, you see that attention deficit hyperactivity disorder was the most prevalent diagnosis, followed by generalized anxiety, bipolar disorder, major depression, and post-traumatic stress. In the last year, you've seen how major depressive disorder has unfortunately risen to number one, as well as anxiety disorder, followed by anxiety disorder. Those are the two most prevalent diagnoses we've seen, and it probably is consistent with what we've all read and seen in the media around the impact that COVID-19 has had on us as individuals. So I find that slide really interesting in terms of comparing previous year to this past year. And then finally, I think the next slide. And then some patient testimonials. I won't read through them. You can see them. But I think, this is interesting in that our staff really appreciates the flexibility. So as much as patients had concerns about coming to the clinics, our staff did as well. And having this technology that allows patients to feel more comfortable in treating whatever experience they're going through is important. It deals with the stigma of coming into a clinic and being seen by a mental health professional when they can do it from the comfort of their own home and really feel good about it. And I think one data point I don't have here is that our no-show rate or cancellation rates have really gone down in this past year, which is important because it doesn't really put the pressure on the patient to have to leave their home, go into a clinic to be seen, and they can do it from the safety of their private residence. So we're really pleased with that. And I believe that's the last slide I have. So again, I want to thank you, Congresswoman, for inviting Aunt Martha's and myself to the conversation. I also want to thank Scott and the McHenry County Mental Health Board for the support that they give Aunt Martha's, and certainly respect and have great admiration for Bruce's work at NACASA. Thank you.
Thank you, Raul. I especially like the data that you shared. The diagnoses that you're seeing is particularly interesting, and so glad that you are in our community to help offer those who need the support, give them what they need in the flexible setting, whether it's in person or virtually. Thank you for being with us today.
Thank you.
Now I'd like to turn it over to Bruce. Hi, Bruce. How are you? Thanks for being with us.
I'm good. Good morning, Congresswoman. Thanks so much for having me. And I just want to say thanks to you and your staff for bringing attention to this important issue. But also, we've received a lot of support from your staff and from you specifically. So we really appreciate it. We appreciate the help for all of our communities. It means a lot when you have somebody that you can call, count on, and help to support, all of the many issues that you may have. So thank you very much. And I'll just talk a little bit. I loved Scott and Raul's comments. Really appreciate their experiences. I'll talk a little bit about NACASA. We have a wonderful grassroots story. We started with one employee in 1966 when there literally were no services in Lake County. And really at the urging of the recovery community, we started an agency. So that one person was actually a Latino staff member, and we have grown our services to 8 locations. We have a residential recovery home as well as outpatient services throughout the county. We do a lot of services with so many of our partners in the community because no one agency can do it all. So we really rely on our partner agencies and so many of the social service and behavioral health providers that we're lucky enough to work with really throughout all of Northern Illinois. So, we really look to provide services to fill gaps in the community where there really is a need, and sometimes that need is emerging. And I think as you talked about, the pandemic and COVID-19, there was a gap because many agencies, unfortunately, had to shut down or stop services just at the very time when, mental health services, substance abuse services were so sorely needed. So we were lucky enough to transition to telehealth. We'd had some experience with that previously, but it didn't come without challenges. And I wanted to just remark a little bit about some of the populations and communities that struggle with telehealth. So it's not so easy to just turn on the switch, and many of our clients unfortunately don't have the requisite hardware, even phones, to do telehealth. And we also find that our recovery community struggles with telehealth services. Boy, they just really want in-person services and they want to feel connected. And I think isolation is affecting so many of us. But I think it hits hard in those struggling with mental health and substance abuse. I really think that it's exacerbated, and unfortunately, it leads sometimes to more substance abuse and use. So that's a real dilemma for us. So that's something that I think all of the agencies are really trying to work on, and certainly providing technology to our clients has been important. But we've found that we've had to do individual appointments longer to try to transition people into telehealth. And interestingly enough, we're finding the same is true now that we're coming back from telehealth, to more in-person services. There is a transition, process. So I think that certainly there's been a lot of challenges. We have some really robust in-school and after-school prevention programs. And I think not too long ago, you gave me a phone call about a drug-free communities grant we received for the Wakanda Island Lake area. And, it's a struggle, though, because we're not able to work with those children in classes and have that connection to them. And I think that that's a big deal today, because isolation is affecting a lot of us, but our youth are really struggling. And certainly with Zoom and, all of that, they're great tools, but we're finding people are zoomed out. So they want to see people in person. But NYCASA we have a couple more slides that, if you don't mind going through, I'll go through quickly. We've really worked hard to meet the community needs. We definitely are partners with our therapeutic intensive monitoring court, so drug court, mental health court, and veterans court. We work a lot with the criminal justice and DCFS systems. So we have family advocacy programs, and we have a RAP program that we're one of only 4 pilots in the state working with DCFS to try to reunite families and really help families in this most difficult time. And the other one more thing I just wanted to mention as a challenge, because I know that was part of your question, we're also finding families that are struggling with basic issues. So, certainly food insecurity is big, employment issues, and, unfortunately, financial insecurity. And that leads to choices between medicine and food. And we found that, we're lucky to be in Illinois in this regard, because there's been a lot of money that we've been able to access throughout the state to help people with housing issues and utility payments. So that's been really helpful. And I can't thank the community providers and all of the staff, both at NYCASA and, throughout the state, that have been working so hard to help these individuals that are so in need. So thank you for having me this morning. Appreciate everything that Scott and Raul has said. And I just appreciate the work that you and your staff do. Thank you.
Well, thank you, Bruce. I'm so glad that you could be with us today, and I certainly appreciate all of the work and resources that you do bring to our community. We know that those who are struggling are often searching for a place to turn to where they can find empathy and assistance, and it's so important that all 3 organizations that you all represent are in our community and continue to be accessible during the pandemic. So first, thank you. I do have some questions for everybody. So first, why do you think it's important that mental health and support for mental health and substance abuse be included in any conversation that we have about COVID relief?
Gentlemen, if you don't mind, I'll jump right in. Most of my work has been at macro and systems levels. So I'd really say it's important because even again, prior to COVID, mental health and behavioral health impacts every one of our institutions, whether it be educational institutions, criminal justice, employment, healthcare, themes that are derived through mental health and well-being certainly impact all of those areas, and they do cost money and they cost lives. So we need to make sure that we continue to speak about mental health as a very pervasive and wide-reaching issue in our communities.
Yeah. And something that I think you all touched on, whether it was directly or as, just briefly as an allusion to it, is the impact of trauma and isolation. So what do we know about the long-term impacts of both trauma and isolation? And what are the signs that people should look out for in themselves or others that they may be struggling?
Yeah, if it's okay, I'll jump in, just because I know this is on the forefront of our minds. We're at historic levels of depression, anxiety, substance abuse, certainly opioid abuse, as well as suicide ideation. So we're at this historic time, and these issues have obviously exacerbated during the pandemic. So it's a huge problem. I'll just talk a little bit about Lake County. We have seen a 25% increase this year in overdose deaths. That
25?
is 25. It's really significant. And those are coroner numbers, and they're, national statistics are bearing out the same. So we've got more people, and I love, Scott kind of hit on this. We've got up to 50% of people that are struggling with anxiety and depression in the U.S. That's incredible. So we've got to talk about it. I think that, the positive sign is that, the American Rescue Plan, I think if I'm not mistaken, actually has provided 10 times more for mental health and substance abuse than previous plans. So this is huge and significant. And I love Scott's message of hope. And I think that's a big part of hope. But just a little bit about signs. We see people that have feelings of fear, anger, sadness, worry, frustration, all of those, maybe even numbness to the fact that, the pandemic is affecting them, their family, their work life. So people are struggling with all kinds of changes in themselves, and watching their children struggle, watching their family members struggle. And I also want to say bereavement is a big issue. We've had, so many people unfortunately lose their lives. That affects the families. So we see a lot of issues with individuals that struggle with sleeping, of course, using more alcohol and substances. That's a big issue. And conditions that are just, either weren't presenting before, but are now and are being exacerbated. So I think those are some of the signs that we've been seeing.
Thank you. And Raul, I hope that you can help us with this question. Something that's always been an obstacle for people seeking help has been stigma around mental health. Have you seen the pandemic have any kind of impact on that as more people are seeking assistance? Or does the stigma persist? And what would you say to someone who wants to get help but thinks that they'll be judged?
I mean, I think by and large, stigma does exist. But, to the point of people needing help and wanting more access, we have seen an increase in that. So as much as we would like to see stigma be eradicated, unfortunately, it still exists. And we have to work with people and helping them understand that it's okay. And I think the point you made in the opening remarks is it's okay to be going through whatever you're feeling about having been isolated for the past year, or people have lost jobs. That's what we're here for. We're here to help through that. Millions of people, to Bruce's point, have lost friends and loved ones. Just as a personal, I think, statement, I lost my father 5 weeks ago to COVID. And and he was diagnosed with COVID on New Year's Eve, hospitalized for 8 days. He got out of the hospital. We all thought, my siblings and myself and my mom thought, oh, he's doing better. He's going to be fine. And then, like we've seen and read, the week before he passed away, he just really crashed. Now, I think for myself and my siblings, we all know my father lived a full life, and we're fortunate. But for my mom, it's been a struggle over the past 5 weeks because she hasn't been able to sleep. She's been struggling. They were nearly together for 60 years. So as much as the physical toll created a lot of stress on my father, I think the thing that was probably more significant, or much more of a toll on him and the family, was our inability to be together as a family. And then obviously the residual of that is watching my mom struggle with it. So I've talked to her about getting support. I mean, certainly as her kids, we're all trying to wrap ourselves around her. But look, none of us are mental health specialists. I mean, 2 of us are in healthcare, but all of us realize that she's going to need support outside of what we're able to provide her. And so we've encouraged her to seek that out. And she's been open to that, which has really been amazing, because as a Latina with many, many years of life, it's not always easy in our culture to go to that resource. And I'm just glad that she's open-minded to it and that she's doing that for herself.
Raul, thank you for sharing your experience. And I'm so sorry to hear about the loss of your father. We'll certainly keep your family in our prayers. And I'm glad that you were able to be that kind of a link for your mom and a resource for her to connect her with the services. As we prepare to close, I want to invite all of you to tell us about how folks can get connected either with the resources that your organization offers or other partners that you work with throughout our 14th Congressional District.
Sure. Thank you. So a couple resources I'd like to share for those around the entire 14th. The state of Illinois has developed the Call for Calm line where you can text TALK to 552020 for English and hablar for Spanish. And then also here in McHenry County, the Mental Health Board's website has an extensive local service directory. And we also have the McHelp mobile app, which can be downloaded at your app store. So we have a lot of pathways to access care, and a big part is knowing how to access. So thank you.
Thank you.
I guess I'll jump in. So I would also say, Congresswoman, your website is great. Under your coronavirus resource page, resources are listed there. Certainly they can come to Aunt Martha's at auntmarthas.org, or you can call 877-MY-AUNT-M. I know Bruce's organization is an excellent resource. And then finally, the CARES hotline, the state's 24-hour crisis response mental health referral hotline, which also is operated by Aunt Martha's, operates 24 hours a day, 7 days a week, every day of the year. That's a great resource as well. So they're out there. People just, I think, need to know how to get there.
Thank you.
And I'll just say, certainly if you need help, please reach out and try to get that help. We're lucky in Lake County. United Way has a wonderful 211 line, so you can dial 211 and you can get assistance for housing, food insecurity, mental health, substance abuse, just about anything you could think about. And that has been a wonderful success. Of course, if you're in a crisis, immediate crisis, you can always dial 911, so certainly you can get help. And then I just want to make sure people know there is a National Suicide Prevention Hotline. I know you have that in your resources. And SAMHSA also has a helpline and a website that can help you find a mental health or substance abuse provider. So SAMHSA is a good resource to find and locate a place. I will say the internet can be somewhat of a black hole when you're looking for help. So the resources that you've provided, Congresswoman, I think are wonderful because they're vetted. People know that when they call that number and they look for help, they're going to get that help. So just be careful not to fall into the black hole of the internet.
Well, again, thank you all so much. What tremendous resources you've offered our communities. Thank you, Scott and Raul and Bruce, for joining us this morning. Before I let everybody go, I want to remind each and every one of our viewers to take good care of yourselves, physically and emotionally. And remember, it's okay to not be okay. There are resources and organizations in our community, including those represented by the three gentlemen with us today, who are here to support and help you or your loved ones if you're struggling. If you need to be in touch with my office, please reach out to us at 630-549-2190 or at underwood.house.gov. And you can follow us online on all the socials at Rep Underwood on Facebook, Instagram, and Twitter. Please have a safe rest of your day, and I look forward to when we can gather again in person soon, hopefully. Be well, everybody.